being recorded.
Wendy,
Okay,
call
I
me.
hereby call to order the meeting of the Community Relations Committee of the Board of Directors of the New York City Health and Hospitals for Tuesday, November 14th. According to bylaw section 13, if any member of a standing or special committee of the board will not be present at a scheduled committee meeting, the member may ask the chair of the board to request that another board member, not a member of that committee, attend the scheduled meeting and be counted as a member for the purposes of quorum and voting. Please note for the record that Dr. Jose Pagan requested that Karen St. Hilaire attend this meeting and be counted as a member for purposes of quorum and voting on his behalf. Karen, thank you so much. We really appreciate it. You've always been great about helping us for quorum. We're also delighted that Sally Hernandez Pinedo and Anita Kawatra are participating virtually. So they're in a listening capacity only. I'd like to call a motion to adopt the minutes of the September 12th, 2023 meeting. Dr. Marcone, Jackie, Karen,
Yes.
okay, and me, we're all in favor. The minutes are adopted. So today, and I hope you don't feel like you got second fiddle. Bob Nolan couldn't come and Jose couldn't come, and so you got me. I'm happy to see all of you, and I'm happy to be here. So I hope that's okay with all of you. So today we're going to have presentations from the cabs of Gouverneur, Harlem, Metropolitan, and Sydenham. I'm going to do a brief report, and I feel appropriately my report should start with, did you all see the picture of Jackie in the New York Times fashion section in the red feather dress? You see? Now I wanted to point out, if you don't pay close attention to the style section, that several of us were there, but only Jackie had her own picture. Right. Everything else was crowded fundraiser. And then there's and here's Jackie. Right.
Representing us.
So I thought that was just great. We launched our public awareness campaign to talk about our New York City Care program. And I would just say, as someone who practices in our system, it gives me such a good feeling when I see the NYC Care insignia, because it means to me that this is somebody without insurance who's getting the same standard of care as everybody else, all the same medicines offered, all the same tests, all the same visits, no difference, and how that is not true in any other system in New York City. That New York City is full of phenomenal healthcare providers and hospitals and clinics, but there's not one other one besides health and hospitals where every single person who is uninsured gets exactly the same standard of care as people who are insured. So some people's line says Fidelis, some people's line say NYC Care, and everybody gets the same thing. Our board member, Dr. Calamia, was on the Staten Island Power 100 list. We had at Lincoln a new mural which was created with input from Bronx youth affected by gun violence. And you'll see we've been having openings for murals fairly regularly. We just had one at King's that was very successful. I think murals are a great way of incorporating the community, the providers, our patients in a therapeutic activity. We celebrated expanded lung cancer screening program, make sure that people get the care that they need. We expanded our services for people impacted by domestic and gender-based violence with 2 new specialized mental health clinics. And we received accreditation for obesity medicine and reaccreditation as Metabolic and Bariatric Surgery Center at Bellevue. Lots of other great things going on in health and hospitals, but I like spending our time hearing from our facilities. So unless there are questions for me, the person I want to hear from is Mrs. Larissa Shaneberg. And I apologize if I've mispronounced your name. Please pronounce it correctly.
Actually, you did a perfect job. Congratulations on achieving
Even a
that
broken
goal.
clock is right twice a day.
Kudos to you. Thank you. So yes, I am Larissa Shaneberg, correctly pronounced. Appreciate that. I'm the current chair for Gouverneur. We have two different sections of Gouverneur. There is the ambulatory side and the skilled nursing facility. I'm here to present the CRC report for 2023. We'll begin, and you can see the slides are already up. We'll begin with the ambulatory side regarding infrastructure and equipment. Of the three sites, our main site, which is on Madison Avenue, Judson, and Roberto Clemente, only Judson requires significant renovations, and that is to our second floor. The goal is to make the second floor useful for clinic space, which will greatly expand the ability to see patients and provide additional services there at Judson Center. Our skilled nursing facility recently went through upgrades for its outdoor garden, and I highly recommend if you are in the neighborhood, make a stop there at that garden. There's a beautiful wall mural. The trees and the plantings are phenomenal. The residents often enjoy the time out there spent on a beautiful day, as well as the staff. They are undergoing currently refurbishment of the dining areas. It is a restaurant style dining experience for the residents there at the skilled nursing facility. It's a wonderful opportunity for the residents to interact and also for the staff to interact with the residents. Currently pending for skilled nursing will be rehabilitation of some of the rehabilitation gym equipment. As a CAB, we continue to focus on identifying structural needs at Judson and Roberto Clemente, as these two centers do fill healthcare voids in the communities that they serve. Our members on the CAB make these needs a priority, and we continue to monitor progress on on anything that is ongoing at those facilities, continue to advocate for funds, and request regular progress reports from the administration. You can go to the next slide. Regarding safety and satisfaction on the ambulatory side, as you can see, they are on par with the New York the New York State average as far as 91% for satisfaction. And the comments that are received from the Press Ganey are taken very seriously by administration. They currently review them, investigate, and find solutions to make improvements based on the feedback that they receive. The skilled nursing facility, their concerns are usually regarding the safety of the facility, which they take highly seriously. And currently, they are at a 90% satisfaction rating for safety for its residents, and overall a 72% overall satisfaction with the facility. And they are also quite pleased with the rehabilitation services. And if you've ever been into the rehab gym, you would know why. Our CAB members continue to focus on outreach to patients, patient groups, and the auxiliary to guide our understanding of the current needs and concerns of patients. And we make sure to relay those to leadership. The leadership is very responsive by responding with data and following up on our concerns and requests during our meeting. There are frequent complaints regarding, well, not frequent, but there are complaints regarding patient communications and access. Typically, these relate to staffing or communication issues and being able to reach their providers. Administration is very aware of these, and they are very responsive. Regarding the skilled nursing facility, complaints, they are low. They are at 1 to 3, 4 complaints per quarter, and that is as per the Press Ganey survey compliance. They are addressed promptly, and most of them surround the food complaints. On a recent tour of the Gouverneur facility, the skilled nursing facility, one thing that impressed me was the sensitivity of those who are preparing the food in the skilled nursing facility to make sure that they are culturally appropriate food so that it gives the residents more of a sense of being home and with family. And also the interaction of the staff and the ability for the staff to advocate on behalf of their patients successfully builds a wonderful environment for those who are currently calling the skilled nursing facility home. We can go to the next slide. The Lower East Side is historically an immigrant and working class neighborhood. It began to experience change in the early 2000s, becoming more gentrified. It is one of the oldest neighborhoods in Manhattan, and it has long been working class. We are very ethnically diverse, and that is reflected in the patient population at Gouverneur and at the skilled nursing facility, and in the sensitivity of the staff toward these differences and cultural needs. As of 2018, the preterm births and births to teenage mothers are lower than the city average, and the population of residents who are uninsured is also slightly lower than the city rate. I think that comes with great advocacy on behalf of MetroPlus and the way that the providers put the patients in touch with the insurance companies and help them find appropriate coverage. There are challenges, and that is concerning the particulate matter, which is small, fine particulates in the air pollutants. It is slightly higher on the Lower East Side than the city average, and we do have a higher rate of smokers on the Lower East Side. Our numbers for obesity, diabetes, and high blood pressure are lower than city averages, respectively, for each of those numbers. Our percentage of obesity for children is at 16% compared to the city-wide rate of 20%, which is better than average. These are still concerning numbers, and they continue to be a focus of the facility. I would like to, at this time, acknowledge that for the dedication and patient-centered care, the improvement of community health outcomes, our diverse community around Gouverneur, I'd like to extend our gratitude to CAB executive leadership and our dedicated members, our Gouverneur auxiliary who are always advocating on behalf of the patients, and to the Gouverneur leadership and employees who are always engaging and very receptive to any feedback and assistance. Thank you.
Thank you. That's a great report.
Really good.
I feel a very special attachment since I practice at Gouverneur, and also because my grandfather grew up on the Lower East Side, as by his own admission, as a hoodlum, and always talked about swimming in the East River, and that he and all of his friends would go swimming there. And so, times have changed. I wonder, are there questions of board members? Please, Jackie.
Yes. Oh, wonderful report. So my question is, the percentage, I seen some percentage of your teenage moms. How many actually participate? And the other question is, how do you really go out and recruit them?
Recruiting for teenage moms?
Yes.
So Jackie, the data I think was meant on the preterm was to give a sense of the community
Right.
stuff. Gouverneur does have a OB, active OB and GYN department. Because it's not a hospital, we don't deliver
Right.
there. So it tends to be more people, the people who do go there at Gouv are usually established patients who've been there for a long time. Usually when someone knows that they're pregnant, if they don't have a relationship to Gouv, they would usually go to Bellevue just because that's our center where we deliver, assuming they're in that Lower East Side area.
So they're being sent from, referred.
Yes.
They're referred to you more or less. Okay.
I've taken tours of the OBGYN facility They're very involved with the patient, with the mothers and with the
Okay.
babies. They're helping them form relationship and understanding how to care for their newborn, how to care for themselves during their pregnancy. It's a very organic relationship that they have with the patients there.
And I would like to add to that, Bellevue Hospital is a perinatal divisional center, so we have the the high risk patients all go to Bellevue. So we have just to show you that the staff are well trained when it comes to high risk maternity and maternity issues that we face. So we have the best of the best. Very proud
That's
of
what
that.
I want to know.
Yes.
Good, good. Okay. Thank you.
Okay.
Yeah, that's good.
Okay. All right, very good. Well, that's a wonderful report, and I'm now looking forward to hearing from Abina more about Harlem. I just saw her. Where'd she go?
Bana Smith. Oh, there's another Bana. I want to meet her. It's okay. Good evening, everyone. My name's Abana Smith. I'm the first vice chair of Harlem Hospital CAB, and I'm seated right next to our Madam Chair, Karen Dixon. But I will begin. So this is the Community Advisory Board Community Relations Report for Harlem Hospital, starting with infrastructure and equipment. As you see on the slide, there has been a collective of 13 facilities management and support services 2022 capital projects that have been completed for a total cost of $45,634,526. Next slide, please. Next, we have patient safety. The patient safety department was involved in many culture and safety educational RCA investigations, proactive risk assessments, and performance improvements activities over the last year. Specifically, giving special mention to the Harlem Patient Safety Committee, met monthly to review topics including the good catches, national patient safety goals, leapfrog survey, and patient safety. The Good Catch program continued to thrive with 105 good catches awarded in 2022 and 205 already in Q1 and Q3 of 2023. And as we see, the year isn't over yet. So that sounds like much progress ahead. Patient Safety led weekly patient safety rounds that taught a different safety topic to the Harlem staff each week. Patient Safety conducted didactics for pediatrics, internal medicine, behavioral health, and radiology residency programs and hosted pediatric residents for their 2-week patient safety elective. 2 patient safety policies were revised in early 2023, patient identification and suicide assessment. Additionally, 2 proactive risk assessments were also conducted. Next slide, please. Frequent complaints at Harlem. Our top grievance categories: attitude, care, and communication. Grievances are sent to the Chief of Service for review and response 3 days, and regulatory guidelines state we should resolve them by 7 calendar days. Patients receive a response letter in the mail in which tells them the findings of our investigation and corrective actions. You'll also see there just below the three examples as to care example, communication example, and attitude example. Some complaints we receive are appointment issues and prescription issues. To go to an example for appointments specifically, a patient needs an appointment with the dentist by having a hard time reaching someone. We would send an email to the manager of the clinic with the patient's information and request. The manager will follow up and send us a resolution. We will then call the patient and confirm that their complaints has been resolved. An example for prescription: the patient needs a refill for the prescription but cannot reach their doctor. We will send an email to the provider with the patient's concerns. The provider will respond with follow-up, and we will call the patient and confirm the resolution.
On that, if I take a pause to just ask your great CEO next to you, George, do you think that in the ambulatory area, people are reviewing the prescriptions to see whether they can be refilled without reaching the individual provider?
There are, yeah, they do have the capability of reviewing it. In other words, if the provider's on vacation, as an example of that. So there is someone else that can look at the prescription and then make a decision on renewing
So
them.
what I'm thinking of, and again, you may need to go and look, and we can always share. So for my practice, if someone calls in a prescription, the first thing that happens is the nurse reviews my medicine list. And then for each category of medicine, the nurses have rules. So if the person is refilling a hypertensive medicine, they'll check to see if it was one that lowers your potassium. Do they have a potassium within 6 months? Then it gets forwarded to me. So this is on your medicine list, and all I have to do is approve it, or it might get forwarded to me with a note saying, this thing has to be done. So I don't have a sense, is that everywhere? Or do I get those kinds of things because it's specific to my outpatient facility?
No, I don't think so. I think it's everywhere because, refilling prescription is a standard thing. We tend to do the 90-day standard in terms of, especially for chronic meds.
Sure.
And we know it needs to be refilled over time. Part of what we're trying to do is move them away from going into the emergency room
Yes.
to be able to get that medication
So
refilled.
important.
So we want them to be able to use, also the other thing we're trying to get them to use MyChart.
Correct.
MyChart plays a great role in terms of sending the information to the provider and saying, I need to refill my prescription. And the provider within 24 to 48 hours will respond to that. And our clinic monitor these things and try and make sure that our provider is able to follow up and get back to it. So we get on my daily huddle. One of the things they do is say the number of requests that's come through MyChart and the percentage of the requests that were responded within 48 hours.
The next time you're on the hunt, just ask, because I'd be interested, is someone seeing it before
It goes to the provider.
it goes to the provider?
I can check.
Because,
for you on that.
again, it makes it so much easier for the provider if someone has already done the stamp. 'Cause again, all I have to do is I press one. In fact, if they have 6 medicines and they've all been reviewed and meet the criteria, there's one button I press, right, and it's refill all. Or I can press one button and edit, and I can refill 4 out of 5 if I don't want to do it. And it's just a tremendous time saver. I think Sally wants to ask a question.
Yes, Sally.
Sally's question, I was just going back, she may have sent it with the previous slide. Go back to the previous slide. Did you have a comment about joint
That's a good one.
conference,
Patient safety.
Joints Commission? Sally asks about the expense related
I think he means from the.
preparing for joint commission. Is that a typical expense? Yes, joint commission preparation. She's asking, is 4 million a typical spend in preparing for joint?
Not
commission?
typical, but again, remember, we just came out of COVID. So there were a lot of other things that we needed to sort of put into place to get that done. There
So
were a lot of-
that particular consultation did capital, not capital as
not
in
capital, but there were a lot of.
bricks, but capital as in rearranging
Correct.
spaces.
Correct.
Okay, Sally, I think that's valid. Okay, sorry to interrupt.
Sally.
You go ahead.
That's, wait, which one? You talking about here? Yeah, you mean the patient, yes. Okay, yes, I'll continue. The Community Advisory Board's Patient Care Committee partners with several departments to support them in their efforts to improve their Press Ganey results and the experiences of patients. And just to be even more specific, that committee has been very good about coming together, going in and meeting and touring as well. Next slide, please. Okay, thank you. I'm sorry, it moved ahead. Highlights. 100% of internal medicine residents passed their boards this year. One resident had a second highest score in the nation.
Wow.
Yeah.
Harlem Hospital Center is a baby-friendly institution.
Mm-hmm.
LGBTQ plus destination. Harlem Hospital Center introduced a robust robotics program. Get with the Guidelines Heart Failure Gold Plus Award. Target Heart Failure Honor Roll. Target Diabetes Honor Roll. Get with the Guidelines Stroke Gold Plus Plus Award. Excuse me. Our challenges: Harlem's aging infrastructure is in constant need of costly repairs and upgrades. Our hospital has worked diligently to replace equipment that has been deemed end of life. Recruitment of certain titles has been challenging, nursing and laboratory, for example. However, the new nursing contract has begun to improve recruitment efforts. We are working to reduce costs by converting temporary workers to permanent line. And last slide. And this, okay, I just still wanted to make sure I give acknowledgement. And this report has been prepared so diligently with the collaboration of Madam Chair Karen Dixon to my left and our amazing CEO, George LeConte.
I can't imagine a better team than the three of you.
Y'all can pay me later.
Well done. Questions for the amazing Harlem team?
I don't have a question, but I have to say I would be remiss, Sally and I. You hear me, Sally? Sally and I paid a visit to Harlem Hospital, and I just want to say thank you to, I never pronounce his last name, so I'll say George.
Yes, perfectly fine.
Thank you
That's
to
funny.
George and Philip. Is
Yes.
Philip cooking?
Philip is
He's
here.
right here.
Oh, okay. The tour was wonderful. Dr. Wright, they did a great presentation. See, we go out to see the goodness. When we go to these hospitals, we don't look for all the bad stuff. We hear the
No
stuff.
bad stuff, Jackie.
Thank you.
No bad stuff.
But since we don't have no bad stuff, we don't look for it. So, but when we go to see the goodness, because you don't have time to really talk about all the good stuff. But we were impressed, and I speak for Sally too, because that was our conversation. We were impressed with the pediatrics, and we were impressed just hearing the doctor about the emergency room, and Dr. Wright. Y'all are a team. And most of all, you have to go to Harlem Hospital to see the art. The art is fabulous. We were so impressed with that art. That art is fabulous. So it's so much more, but I just want to take the time to say that and to thank y'all and the team. So keep up the good work, because that is the hospital that when I get sick that I have to go to and stay in. So I was glad, doctor, you asked about the prescriptions, and that's why I say yes, Sally, but the prescription, because that is my hospital. Of course, my clinic is Sideham, but that's my hospital. So I just wanted y'all to know, we talk about what is wrong, but I wanted you to know we saw a lot of right there, Sally and I. So keep up the good work. I just want to say that.
Jackie, you were talking about art, but you didn't mention the documentary video that George made on colonoscopy. Right.
Oh, that was an art creation. Did you?
Recognizing that African American men are
That's
reticent to get colonoscopy. He starred in his own documentary. My favorite part was, of course, the hairnet. Right, he's there in a hairnet, and I'm like, why does George need a hairnet? I'm like, talk about like wasted resources. George, we're on a tight budget. What are you doing wearing a hairnet? But the man was terrific.
Wasn't he?
He was terrific.
We have to put him on in a movie.
I thought he was amazing.
Thank you.
Anything else? Okay. All right. Very good. Then I'm looking forward to hearing from Mr. William Smith on Metropolitan.
Good evening, everyone. And I want to welcome, we have some of our cab members here. All of you could just stand and say hello. So good afternoon, members of the board. Thank you for the opportunity to provide an update about the great work of our hospital, Metropolitan. I want to take the opportunity to thank the members of our community advisory board, as I just mentioned, for their continued work and obviously making the trek down here. So thank you for your sacrifice. I want to thank our CEO, Ms. Contreras, and the hospital administration for their great partnership with our cab and the broader community. The hospital leadership is always readily available to work with us and provide us with the resources we need to advance our mission as a cab. The C-suite team continues to attend our monthly cab meetings and keep us abreast of the updates of the hospital and the great programs that the hospital continues to roll out in our community. And we always actively seek, they always actively seek our feedback about ways to better work with the community and collaborate to advance the mission of the hospital and improve the administration of the hospital. I know that many of our CAB members use Metropolitan for their health care. I know that I do. I think last year I mentioned I've received all of my COVID vaccinations and obviously get my flu shot this year. Thankfully, I didn't get sick. So something's right in the serum or something. All right. As you can see from our report, in regards to our infrastructure and equipment, we've been quite busy this year. We've obviously had continued the construction of our flood wall, which is a great project. So I want to thank the hospital administration, as well as central office, for all of the work that you've done to bring this project to fruition and the impact that it will have. God forbid we ever have a massive flood, so we can maintain our mission as a hospital and serving the community. We continue to advocate for $65 million to renovate our emergency department, which is 67 years old. So I want to thank the administration for their advocacy. They have met with our member of Congress, Congressman Adriano Espaillat. They've met with the New York State Lieutenant Governor, our Council Speaker Adrian Adams, Deputy Speaker Council Member Diana Ayala, as well as Borough President Mark Levine. You can go to the next slide. Okay, thank you. Okay, when we think about how the hospital is addressing patient satisfaction, I want to highlight the fact that the Patient Family Advisory Council has been reestablished with the mission of enhancing the hospital experience for all patients, so that way we can work to address the frequent complaints and improve the experience of our patients and families in the hospital. So obviously the CAB looks forward to supporting the work of this reestablished council and working with them to advance our collective mission and supporting the community in the hospital. Next slide. I want another notable, we opened our Comprehensive Pride Health Center in April of this year, which is a dedicated safe space where the LGBTQIA patients can receive care. We've been providing care for LGBTQIA patients for over 10 years, and the new center is a one-stop shop where they can take care of all of their health care needs. Okay. Metropolitan's Breast Center was granted a full 3-year full accreditation designation by the National Accreditation Program for Breast Centers. This recognition means that our breast center has the highest care standards for treating breast disease. Okay, next slide. Okay. We will continue to work with our elected officials so that we can get our fair share of funding to support patient care and our capital needs. We've been advocating for funding to renovate our emergency room, which I previously mentioned, and have been inviting elected officials to visit the Metropolitan to see firsthand the great work of our hospital. And as I previously mentioned, some of the attendees who our administration has met with. So that concludes my closing remarks. I just want to say I want to thank everyone at Metropolitan, the CAB, of course, for their tireless work. They keep the administration busy with a lot of their innovative ideas on how we can improve our work as a CAB. And of course, thank you to Ms. Contreras for your great work in helping us and your service and dedication to the East Harlem community. We greatly appreciate you, and we want to make sure you stay with us for a significantly longer amount of time. Okay.
I owe you $5 for that.
Well done. Well done. Yes, I wanted to. One of the great things about Metropolitan Hospital is how it's always helped its sister hospitals when needed. And Christina was telling me about some of the excellent work she's doing we're trying to relocate rehab at Metropolitan from Jacoby and Bellevue, because at those hospitals right now, we have a shortage of medical surgical beds. And so people are staying too long in the emergency room. And rehab really represents a different stage in your care. So it's many people move for rehab. So it's a common time. And by coming forward and saying, we're happy to take these patients, we have the capacity and we have the love, and they have a wonderful rehab department, it will enable other patients to be able to go more quickly to medical surgical beds at Bellevue and Jacoby and not be stuck in the emergency room. So it's just another example, as was in COVID, where Metropolitan really stands out to help the other hospitals. So, thank you, Mr. Smith, thank you, Christina, and all the CAB members. Okay, so now we go to Jackie's clinic presentation. Mrs. Gill, you're going to give our presentation?
Yes, I am.
Wonderful.
Good evening, everyone. My name is Donna Veronica Gill, and I'm the chair for the Sydenham Jackie's Clinic, Gotham Healthcare Sydenham's Clinic. To begin with, we're we are 3 health centers all over Central Harlem and in Dyckman Heights. We have a center at Sydenham. We have a center at Dyckman, in the Dyckman housing, and we have a center at St. Nicholas. So Sydenham encompasses all 3 of these locations. Infrastructure and equipment. We've been asking for an ultrasound machine. I've been going to electeds, asking them for ultrasound machine, and we finally got one.
Yes.
So our women's health department is actually doing very well because of that particular machine. Because before we had to utilize Mr. LeCompte's wonderful service. and now we have a machine of our own, so we can take care of that. We've also, with equipment, we've also gotten a new panoramic X-ray machine. Next slide, please. Next slide. Okay. New panoramic X-ray machine for our dental service. We find that our dentists or our dental services are utilized a great deal by the community, and the panoramic X-ray would help with that, where our dentists can actually have a better view of the total dental picture for the patients, and the children seem to love that. And we have over 1,500 patients that are going to be benefiting from the panoramic X-ray. Next slide. Patient satisfaction and safety. The site department, we have communicated with all our different sites to have our patients incentivized. And our goal is to ensure that our patients are aware of their health needs and can accommodate that. Patient complaints, we've had that. We have our patient complaints, our major complaint is actually appointments, and getting appointments, making appointments, and we've actually done a lot to minimize that. Next slide, please. Okay, so yes, and this is what we've done. We've restructured the directory with the call center and provided patients with an easier way to contact us for scheduling. So that's how we are mitigating that, that particular issue. That has been an issue with Sydenham for quite some time, ever since our services were moved um, downtown. And we have been trying, and it's actually working because we've actually got a handle on that particular problem. So we have a quasi solution to that. One of the other issues we have is, and I spoke to the community board, is the ambulatory parking, the amulet parking in front of Sydenham, because we're in the middle of the block on 118th Street. People tend to not see the sign or see the sign and get amnesia while the sign is there. So we have to have our hospital police monitor the area to enforce ticketing for violations, and it's become an issue because when our patients come in with accessoride or something like that, there's no place for the vans to park. And then how is the patient going to get out of the van to get into the facility? And they have to park in different places. Maybe have to cross the streets. That's traffic. So that is one of our major issues that we're working with. Right now, we've been able to get a sign from Department of Transportation. You know, and that has helped. But the police, that is, hospital police at the front door, is actually has to physically get up and go outside to make sure that people are not parked there. So that is an issue for us. Next slide. Thank you. The issues and the impact of the community. Um, we had a National Health Week. We invited the community to come in. We had BMI screening for adults and children at one of our other sites, the off sites, but I don't like to call them off sites because we're all three uh, clinics that operate in conjunction with each other and interchangeable. We had signage change, which the community really loved, because when you go to a place and you don't see um, signs, or the signs are not clear, and you go into a community that's not speaking English is not their first language, it tends to turn people off and they don't want to come in. So when you change the sign and people know that you're there, then you tend to get more people coming in to your site. We are an American Heart Association Gold Star for hypertension, diabetes control, and we have exciting news because for the community, we just had a mural on our second mural, because we had the first mural 2 years ago,
Yes.
and which is a great mural because it's all about the Sydenham history and the protests and everything about the hospital closing. So that was really impactful for the community because it related to a lot of them. And now we have Roses of Harlem, which is our new mural, which is on the second floor. And I'm sorry I don't have a picture of it because it's quite beautiful. And it has Dapper Dan and the Eye of Horus and flowers and trees and sunshine, and it's purple, predominantly colored purple, but it actually makes the second floor waiting area bright, and the patients are very happy. And the way that it impacted the community is that we invited the community to come in and help paint the mural, and that was very exciting, and they really love that. We have 90% on HIV quality improvement. We have patient engaged, HIV patient engaged in primary care. We have classes in diabetes and nutrition, which for our community, nutrition is a big impact on lives, impact on people with diabetes, people with hypertension, and our nutrition staff is excellent, and the patients are very appreciative of that. 90 percentile for Metro Plus, telerenal eye exams. 97% of our patients are screened annually for depression, which is something that the rest of the world is just getting on board with when they realize that mental health issues are extremely important, and people's health and mental health is actually most of the things that are very important. 75% my chart enrollment. Next slide, please.
Before you go, just say these are phenomenal numbers.
Yes.
Right, I mean, they're worth, right, really admiring, how great, especially the 90% on HIV and the
HIV,
90% on teleretinal eyes and 97 on depression. I mean, those are really, really phenomenal numbers. Congratulations.
Thank you very much. The issues that impact our community. We have vacancies that are not being filled. Recruitment in different titles. We have been approved to backfill, but they're still not in nursing. We're actually looking for our medical director because our medical director is gone. So, excuse me. Speaking of vacancies, and we've accomplished a lot of these things with all of this transition going on. And we're still looking. I said, it says nursing, but I think a medical director is actually more important than.
We'll
not
get you
more-
both.
equally-
We'll get you
Yeah,
both. You need them both.
Yes, equally as important
Need
as
them both.
nursing. So it is an equal. We had an issue with 340B. We had a pharmacy located in our site. That pharmacy was closed. The residents, the patients, the clients were not particularly happy. We had the doctors were not happy, and the doctors wrote to the community board, and then the community board 10 had to figure out how do we solve this problem and who is going to solve this problem. Because once we had the pharmacy, everything was fine. However, it closed for whatever reason.
Well, maybe worth saying, at least as I understand it, because I think the first thing people think is someone was worried about money.
Yes.
And that was not at all, had nothing to do with money.
No.
Right. It had to do with, we believed that under the new rules for pharmacy, the ventilation in the basement would never have been approved. And so we're committed to continuing to try to find a good solution. But I just don't want anyone to think,
that we
because
did it for money.
people
No.
close stuff for money all the time in
Would
New York
not have
City,
happened
and we
with
would
my
never
cat.
do that.
We wouldn't let that happen with my
Absolutely.
cat.
We would never do that.
We have to have a good reason. So, we've made solutions. We met. They met with CVS. They had the CVS on 125th Street. I don't know if everyone knows the area. I was not happy with that. I wanted a CVS where people felt a little safer. One further down because 125th Street in Lenox is
A rough spot.
it's a notorious rough spot. So they did, and there was a CVS on 116. I asked them, why couldn't we do 116? So they were able to get contract with all of the CVS in the area, which was fine. We had we do patients drop off. We do pharmacy delivery. We give patients MetroCard. So we have been very accommodating to our patients. And if the patient
Right.
wants to stay at Sydenham or any of the other clinics, we would pick up their medication and bring it back
Absolutely.
to them. So we're actually making it very easy. The transition has been very smooth for our 34B patients.
But transitions are always hard.
Yes.
Yes.
Right. But I wish my pharmacy would mail me my medicines. I'd be happy with that. Do people take advantage of home, or are people worried about security or the mail?
No, I mean people take advantage of home because we have to think about people that are not ambulatory, that cannot leave the house or afraid to leave the house. Accessorize, so if they get the medicine delivered
What
to
could be
them,
better than having your medicine delivered at home?
they would love it. Yeah.
So let me jump in to Dr. Great report, and I know you're not finished, but I have to add to it too. Gotham really jumped in. That's who Donna was talking about when she said they. They really listened very hard and carefully to us. And the needs that the patients was asking. Not only that, we do have, let me tell you, Donna not only the chair, she on community board. So after fighting, the thing is, Gotham made sure we made it so comfortable for the residents till they stopped complaining, truthfully, because they were able to send someone to the clinic to pick up their medicine. Then they provided vans. So I want y'all to hear this. We went to work at Sydenham
Good job.
clinic. They have vans to pick up, right, Donna? To pick up the medicine and take it to the patient. Then, if they did not want to go to CVS or one of those pharmacies, we made sure that it was sent to the clinic. So that, first it was a hardship, as you know, doctor, because you were working on stuff.
And change is
and,
hard.
and Deborah, Gotham really was on top of it. But at the end of the day, what Don is trying to say, we really need another some space that we could open up, deal with the pharmacy, and that's what we're working. It's on hold right now, but we are working, and I know you're looking for.
Right, and isn't the long-term plan,
Yes.
the ideal long-term plan would be another physical site for all of Siding Brook
Absolutely.
with a space that was appropriate for pharmacy. I mean, that's really, because it wouldn't have,
That's it.
we don't want to create a pharmacy for Sidingham somewhere other than at Sidingham.
That's right.
Right, and it's not gonna, there's no place in that building that we could get a pharmacy approved.
Absolutely.
So what we really need is a better
Okay.
site.
Yes.
A better location.
Because you see the growth. That facility, and I'm not bragging because it's my clinic, but I am saying we have so many patients, it have overgrown. People love Sideham, Gotham.
course they do.
Slash Renaissance.
Of
It's three
course
names.
they love it.
And so it's growth. It's growth. We have really grown. And trust me, to God be the glory, 2024, we're going to have something. Right, doctor?
We're gonna come up with something.
Okay. Thank you very much. I appreciate it because that was one of the things I was going to speak on, which is not on the slide, but we needed to find a space for us. So with that, I'd like to thank you, Dr. Katz and Jackie, my cheerleader, and all of the next slide, please. The district political wheel that has been turning for us. The Manhattan Borough President, Robert Jackson, which people forget that he's actually part of Sydenham because he's in Dykeman,
Right.
and Dykeman is in his district. Hazel Dukes and the fire department who did our drive-by and celebration and they do come by for COVID for our nurses, and the St. Nicholas Tenants Association and Dykeman Tenants Association. And that's it. I apologize that what is she called? my executive director is not here at this point, but I think I could.
You did
answer
great.
any
You did
questions
great.
You did great.
that you
And
guys have.
Doctor, may I add, I want to thank her. I never say, I'm not good at saying some names, but Miss
Pabon.
Pabon,
Mhm.
and she's been doing a great job being on top of stuff. I want to thank. Is Rodrita here? I didn't see Rodrita. Oh, a great team at Sideham,
Next slide,
and I
please.
just want to thank all of you. Oh, you still have another slide.
Yeah, I have. Okay, so that's
Yes,
our
yes.
team.
Am I in the pictures?
That's
Here I am.
There you
Here I
are.
am.
That's the Sydenham team. I want to thank my cab and thank Okemfe and Iman and
That's so
Debbie
good,
and
that's
everyone. It's been great. And Miss Singh, and we went to visit all of the centers of excellence that H&H has. So those are things that we've been doing, trying to partner up and get Sydenham on the map, which it's on the map.
It's on the map.
Thank you. Thank you very much.
I think she have a question, Doctor.
No, I was just adding, I'm actually the new regional director of nursing for Sydenham.
All
That's
right.
why I
Oh, wonderful.
Really?
That's great.
Welcome.
Okay, they need a nurse. You
Yes.
you gotta recruit them a nurse.
And she said that I'm already on it.
That's great. That's great. It's a wonderful place to work. I don't think you'll have trouble finding someone who will love being there. Other, please.
Yes, I do have a question. Donna, first of all, congratulations. That's a wonderful report. Lovely to see all the progress that's being made. I enjoyed your event last year for the Sidingham. Beautiful pin that you made. The murals are gorgeous. And it's a wonderful, warm environment.
Thank you, Larissa.
I have a question about, I don't know if you can answer, but regarding the interpretation equipment, you have a video interpretation for those who are,
Who are not English? English is not their first language.
and
Yes.
and for deaf.
Yes, and
Yes.
for people that are hard of hearing.
So,
yes.
do you also offer in person? Because I know I've experienced in the deaf community a lot of complaints, especially among the older adults who have difficulty seeing. They have trouble seeing that small video screen and to understand the interpreter. So, do you offer alternatives for those who are hearing impaired?
Have alternatives every day, but we do try to have someone there because we do understand. Because I'm technophobic, I don't like looking at my phone or checking the computers or seeing anything on there. I'm very tactile, so I need to see someone, and I'm very concerned with the differently abled community because I don't call them that other word. So we do try to do that, to get that in there.
I feel this is all generational. I feel my 21-year-old and 19-year-old are going to evolve to not be able to notice humans. That unless it's on a small screen, that it's going to go by them. That only things seen like this are real and everything else is imaginary. And then my parents are, of course, the complete opposites, refuse to use a phone. My father always refused to use an ATM card, and I believe the reason is he felt that if he pressed the wrong button, his money would go to someone else. Right. So it's funny to watch the different generations, and what's accessible to one isn't accessible to another, and that's what makes the world so interesting. Any other questions for Donna?
I don't have a question, but just want to share some information that was brought to my attention earlier today while I was in a meeting, and the fact that you mentioned about CVS Pharmacy. So this is for like everyone who wants to look into it, because we're going to look into it further. That people are getting conscious and aware of the fact that CVS is sharing their information. So now they're saying that they're not in compliance, total compliance of the HIPAA law. And folks are worried that it will use to be weaponized against them at a later time. So in order to get ahead of this, I'm just hoping you guys could look into it, because the organization that I'm with, we're going to look further into it. But it's funny, in the meeting was 4 people agree that it happened to them, that they're aware of information has been shared with another pharmacy and another party, whatever. So just want to share that, because that's,
Thank you.
that can be dangerous moving forward.
Absolutely. Thank you.
Thank you very much.
Questions? Well, it is certainly great to spend this hour all together, and I hope all of you, feel proud of your role in making Health and Hospitals what it is. I mean, Health and Hospitals ultimately would never be the organization it is without so much positive community involvement and spirit and accountability. And we appreciate, we know that you do a lot of work in your committees besides coming here, and we greatly appreciate it. So with that, my script says, any old business, any new business.
Well, new business, I just want to add, I don't want to forget anyone that's really out there doing the work. I want you to let Michelle know, Miss Lewis know, that we're very proud of her. She's really working hard. And of course, my Ted, he is the bomb. He really is. He's doing a great job, and he's keeping all the stuff he's doing, he's keeping everything together, Doctor. Really good.
You can't say that anymore, Jackie. No longer do adjectives about people's appearance.
No adjectives.
No
but
adjectives.
Thank you so much for all the hard work that you do.
Everybody, it's a joy to be with you. Have a great night. Thank you so much.
Thank you. Good evening.